Hi everyone, I'm Ashley and we're PneuTech, revolutionizing the safety of biopsies. Lung biopsies are a critical procedure to diagnose cancer and track patient treatment. Despite the necessity and frequency of percutaneous lung biopsies, with over 150,000 U.S. patients each year, 1 in 5 will have their lung collapse, resulting in overnight hospital stays and long-term health damage. Also, 2 in 5 patients will need a repeat lung biopsy, with 1/3 due to a lack of collected tissue. This results in over $250 million spent each year in the U.S. on lung collapse mitigations and repeat biopsies. This is because this same straight biopsy system is used across organs. Since both the hollow guide needle and biopsy needle are straight, it is impossible to navigate around ribs and blood vessels and sample more than one area of tissue in just one attempt. This causes the doctor to remove and reinsert the entire biopsy system for an average of 3 punctures per procedure, increasing the risk of a lung collapse. Here, the doctor had to take multiple attempts since a straight needle cannot follow the green angle path around the ribs, and only a 10-degree curvature would be a game changer. Therefore, we have developed the very first biopsy needle attachment to enable both an angled and straight path to access any site in only one puncture, the TroCap. The TroCap is a mechanically controlled device that seamlessly integrates with the standard workflow and biopsy system, and it has an airtight handle to further reduce the risk of lung collapse. The TroCap fits inside a standard guide needle and allows a biopsy needle to slide out at the prescribed angle. Through this technically feasible design, the TroCap will create a world where lung biopsies are safe for all patients. Patients will no longer have to worry about pain, complications, or repeat biopsies for more tissue. And every doctor conducting a biopsy will feel confident that just one needle puncture will collect sufficient tissue for both diagnosis and personalized medicine. And our path searches have shown that we have a clear competitive edge with freedom to operate. There are no other innovations in the standard core biopsy space, and the cost, training, and maintenance have caused our stakeholders to be skeptical that disruptive robotic-assisted devices would ever be accepted as a new standard. Furthermore, our TroCap is adaptable to all biopsies, facing the same navigational challenges as lung biopsies. We will initially target the U.S. percutaneous lung biopsy market, but our device can assist 1.2 million patients in the U.S. each year, to those needing liver, kidney, and prostate biopsies. This is all within a fast-growing market. The U.S. biopsy market is expected to reach more than $14 billion by 2025. This directly translates into immense growth potential. By selling our reimbursable TroCap in packages of 5 for $250 directly to hospitals, our projected revenue for U.S. lung biopsies is $7.5 million each year, which will rapidly expand to a revenue of $62 million each year in the U.S. These remarkable projections are due to the extremely low manufacturing cost of only $20 to produce one TroCap. To date, we have fabricated and tested over 10 TroCaps, with 3 achieving the critical 10-degree curvature, and our airtight handle blocks all airflow. We've interviewed over 15 stakeholders, have won provisional patent pending submission with JHTV, and have won 4 BME awards and $19,500 in non-dilutive funding. And in fuel specifically, we accomplished significant milestones. We identified our FDA and market entry strategy, used our funding to build 2-scale prototypes, conduct end-user testing, and the project communication from a hot seat session led us to win first place at the Carnegie Mellon Venture Competition. The demo day funding would be game-changing. In the next 9 months, combined with our other funding, $5,000 would support the integration of our first device ready for detailed testing in the CT environment. And $20,000 would allow us to validate safety and efficacy with our first translational animal study, all while furthering our business developments. What is truly remarkable is that all of this is achievable because of the TroCap's technical feasibility, which perfectly sets us up for our business model. We will exclusively license our IP, accelerate through the FDA pathway as a Class 2 510K device, network with physicians to champion our device to purchasing departments, and launch our TroCap into the market as a reimbursable accessory to the standard biopsy procedure with clear patient and financial value. Clinicians and hospitals would be eager to be our customers. As a dedicated and passionate team of biomedical engineers with strong clinical, business, manufacturing, and industry partners, we're uniquely situated to bring this device to market and improve the safety of biopsies. Thank you.